Viewers, tobacco is the single greatest cause of preventable death worldwide, and the burden of tobacco-related cancer is increasing alarmingly. It is estimated that nearly 5 million people die due to tobacco use every year, and this figure will increase to 10 million by the end of 2020. According to World Health Organization, on the worldwide basis, tobacco kills to the equivalent of one jumbo jet full of people crashing per hour, 24 hours a day, and with no survivors 365 days of the year. It is very, very alarming situation. We know that tobacco kills many people and it is harming the health of common man. So we decided to take this important issue of tobacco and its health hazards on today's show of Health Hints. Welcome viewers, this is Rinku, and today we have invited two eminent experts here. Let me introduce first Dr. C. Bhuya. He is the Chief Medical Oncologist, Dr. B. Barua Cancer Institute, and to my next, Dr. Jagannath Sharma is sitting, and he is the Chief Consultant Pathologist of Dr. B. Barua Cancer Institute. Welcome both of you here to our show Health Hints, and with you we will discuss and analyze the tobacco and the cancer. And along with the doctors, we have eminent panelists here, audience here, who would definitely ask some questions related to tobacco and would help us to make this discussion interesting. Welcome audience here to our show Health Hints. Now let me start with Dr. Bhuya. Before we discuss what kind of cancer tobacco causes, let me first ask, how would you define tobacco use?
No, tobacco is a plant product. We know that there is a plant which is a tobacco plant.
Okay.
Any part of the plant, be it the leaves, stem, or the flowers, shoots, if we use in any form, and then it's tobacco use. Commonest is the use of commonest use of tobacco is like by a cigarette or a bidi or a tobacco, khaini. These are the ways by which we use tobacco. There another way is taking hookah. It was an old fashion, but it's becoming more popular amongst the metros nowadays. You'll see hookah bars here, right? Another is the non-smoking tobacco, smokeless tobacco, and it is becoming more alarming now that this smokeless tobacco is becoming popular amongst the younger people by the virtue of that, by the product called gutka.
Gutka. Okay, doctor, and you have mentioned about younger generation. We have questions on that, and I'm sure our audience is eager to ask. But before we go to our audience, let me ask Dr. Sharma. He said that tobacco use is not limited to smoking cigarette only, it's related to hookah also. So I just want to know, because people have a perception that if you stay away from the chemical nicotine or the cigarette, you are safe from cancer. Do you think that hookah also, what you're feeling on that, hookah also causes that much serious threat, that poses serious threat?
The use of hookah is actually the smoke is filtered through the water and it is inhaled. As such, it is also tobacco, smoked tobacco, so it is also equally dangerous. But the most important thing is this, in some part of the northeast, particularly in the Mizoram, what they do, they used to take the hookah water, the remnants of the filtrate, that is only filtering the, the harmless, so-called harmless, as people perceive the inhaler. But the hookah water contains lots of hydrocarbons, lots of chemicals. It's not the nicotine only, lots of carcinogenic chemicals. And in the various parts of the Mizoram, they used to drink it. And it has been, epidemiologically it has been seen that the reason for the high incidence of stomach cancer in the Mizoram may be causally related to this sort of habit.
Doctor, before asking, I actually wanted to ask you, because it is found that, the studies have found that in the northeast region, the incidence of cancer, especially lung cancer, is more in Meghalaya and Assam. What are the reasons behind it? We will definitely would like to know, but let me go first to our audience. Audience wants to ask some question. Yeah, you can ask the question.
Hello, sir.
Can we know your name, please?
I am Hemanto Narandas.
Okay.
I want to know, actually, most of us we know that tobacco, seeing and smoking, all these are harmful to our body. But it is awareness program, different awareness programs is also going on, and people also aware about it. But actually they do not know why it does happen, what is the which which kind of chemical actually responsible for happening this cancer actually?
Very good question. He actually wants to know what exact reason. So, Dr. Bhuya, would you like to take this?
Actually, I will divide the chemicals into two parts. It will be easier for you to understand. One is tobacco is a habit-forming thing. This habituation is caused by nicotine. And there are other chemicals in tobacco which actually are harmful for cancerogenesis or forming cancer. These are the hydrocarbons, nitrates, nitrites, these are gases, tar. If you burn a lot of cigarettes and put a plain paper over the you will see that black tar forms on the, this is just like coal tar. This is laid on the pitch on the road. And these are the chemicals which really are harmful for our body in the matter of causing cancer. What these chemicals do is that they harm our genomic structure. In the cell, there is a nucleus, and in the nucleus, there are chromosomes. It breaks the chromosomes. When there is a breakage of chromosomes, then the genes get apart from each other. And then this cell becomes abnormal. And this abnormal cell is a cancerous cell. Once one cell becomes cancerous, it will start dividing exponentially and form a tumor, which is the cancer actually. This is how it forms.
So nicely explained. Let me take the second question. Yeah.
Yeah, I would like to ask you one question.
Okay.
I'm Sushil Sengupta. Yes. The one who can be called as chain smoker. So if that particular person stops all of a sudden taking tobacco or like that, so what effect will be there on him?
Very good question. Dr. Sharma will take this, but let me know, because we will come to this question later. First, I would like to know how many types of cancer are there?
That means, you asking me the tobacco-related?
Tobacco-related cancer.
Yeah, according to International Agency for Research on Cancer, it is the WHO body for ultimate body of the cancer research is located in Lyon, France. So, they have divided the size of the body in which the cancers are related to the use of tobacco. It starts from the lip, oral cavity, pharynx, esophagus, stomach, cervical cancer, and some form of leukemia and urinary bladder cancer. These have been causally, it has been seen epidemiologically and from the animal experiment also that these have been causally implicated to cancers.
Dr. Bhuya, would you like to add to it?
Yeah,
because usually
Dr. Sharma has already told about this causal relationship of this. I think I'll answer his question. What will happen if somebody stops suddenly? For a day he will not take. The next day he will go stealthily and take the cigarette, because he cannot stay away from cigarette. It's his habit. Now thing is that if he is so determined to stop his habit or for stopping tobacco, then there are measures. He will need some medical help. He will need some psychological support. So he needs to go to a tobacco cessation clinic. Tobacco cessation clinics are now available and running in the city. At least it is there in Guwahati, and I know there are many places in the northeast, in the big hospitals, there are tobacco cessation clinics.
One in our hospital also?
There is one in our hospital which is functioning, and a lot of people do come over there. But first and foremost thing is that the person must be determined to stop tobacco. It is his determination that will ultimately decide.
Doctor, I would like to add, because he asked a very good question, I would like to add here, what you feel, what are the first immediate effects you can see on a chain smoker if he wants to quit?
He will, we call that, the doctors will call that an withdrawal symptoms. He becomes irritable, and then he cannot concentrate his mind into anything. If you can now remember, anybody who smokes will take to a cigarette before he takes to some writing or something. This is what is, sort of lack of concentration because of withdrawal from smoking. Actually, his blood level of nicotine goes down. So he wants to put in more nicotine into his blood. So he takes another cigarette. Now, if we can give him some nicotine without avoiding tobacco, there are ways, there are nicotine available in tablet form. Then probably he can avoid going to a cigarette.
Okay,
there
doctor,
are nicotine tablets available, chewing in the form of chewing gums. And this has to be medically prescribed, not like you go and buy and take.
Okay, you want to say that these tablets, nicotine tablets,
Yes.
is monitored by the hospital or the
doctor,
doctors.
and
Okay,
it
under the
has to-
supervision of the doctor,
yeah.
you can have this.
Ultimately, our idea is that we want to take the patient out from the habit of tobacco. So the doctor will monitor. He will give nicotine tablets initially, and gradually he will reduce the amount of nicotine tablets. And one fine day, we will stop the nicotine tablets as well, and the man will be free from it. That's simple actually. Although it is not practically very simple, there are a lot of psychological support that is required and a determination from the man.
To add
Okay.
to this something on this in his
Yeah, sure,
question,
go
I may
ahead,
add
go
one
ahead,
thing
yeah.
that there's a good thing, good question, but one important thing epidemiologically it has been seen that one who stops after taking continuously taking a cigarette or smoking for quite a bit of time and stops, then also there is a good thing that he is also reducing his risk towards cancer. That's what going to take. That's improved already.
Okay, because today in this episode we are more discussing, we want to concentrate more on tobacco and tobacco related cancers.
Cancers, yeah.
So let me take another question from, he wants to ask. Okay, you want to ask, yeah.
মই গীতামণি শৰ্মা এটা কুৱেশ্যন সুধিব খুজিছোঁ প্ৰেগনেঞ্চি চলি থকা সময়ত মহিলাগৰাকীৰ স্বামীয়ে যদি অনবৰতে ধূমপান কৰি থাকে তেতিয়া তেখেতৰ হ'বলগীয়া শিশুটোৰ কাৰণে কিবা বেয়া প্ৰভাৱ পৰিব পাৰে নেকি
Gitumani Kalita, right?
গীতুমণি শৰ্মা
Gitumani Sharma. She is actually, which I actually wanted to ask, paternal smoking. How the paternal smoking affects the mother, especially the would-be mothers.
The father smokes and the wife, the husband smokes and the wife is beside and the baby inside in his womb. The woman is a passive smoker. So how she gets this harmful tobacco smoke into her blood, and through her blood it goes to the baby, and it's going to produce the same bad effect on the baby as it is producing in the husband and as it is producing in the mother.
Very, very nicely
So,
said, Dr. Bhuya.
If we have to
Yeah.
be a responsible father, you have to stop smoking or at least get away from the wife when you smoke. Don't smoke in front of the wife or when the wife is around. Especially, I will suggest, don't smoke at home at all. That will also help you finally reducing your amount of smoking, protecting your own health
Financially also.
and finance.
যদি মানে এইটো মানি নচলে তেতিয়া বাচ্চাটোৰ ক্ষেত্ৰত কিবা কেঞ্চাৰ জাতীয় কিবা এনেকুৱা হ'ব পাৰে নেকি
Obviously, the baby is going to suffer. I won't say that the baby will get cancer in an individual case, but it's going to suffer.
It's going to
And
suffer. Let me hear from
secondly,
Dr.
the placenta,
Sharma. Yeah, Dr. Sharma,
placenta
coming to
which
you.
is there in the womb.
So
Okay.
just
He wants to add something on passive smoking, right?
Responding to her question, one thing is there's a very substantial amount of evidence that baby is born out of the smoking mothers, and also the mothers who have been passively affected by in presence of a smoking father. There's a high level of the growth retardation.
Yeah.
Growth retardation of baby. So now coming back to the passive smoking,
Yeah.
I'm just technically speaking, there are two types of smoking. One is mainstream smoke, and one is the side effect smoke. Mainstream smoke is that what is inhaled from the burning end of the cigarette, right? And the
You're directly inhaling
and
that.
the side effects smoking. That is side effect smoke is when the person is not actively smoking, but the smoke that is liberated towards the environment. So what is passive smoking? Passive smoking is combination of both, and it has been seen that the concentration of the harmful chemicals is homogeneously distributed in both the smoke. So it is equally dangerous.
So passive smoking is equally dangerous,
dangerous.
and we have to avoid passive smoking at all cost. So can we have another question from the audience?
নমস্কাৰ মোৰ নাম শ্ৰী সবিতা দেৱী মই প্ৰশ্ন এটা সুধিব খুজিছোঁ যে নিচাজাতীয় কোনো বস্তু সেৱন নকৰিলেও কেতিয়াবা কেঞ্চাৰ হয় সেইটো কিহৰ কাৰণে হয়
Okay, Dr. Sharma, would you like to take
Yes.
this question?
Even
Even if you
very-
don't smoke, can we get cancer, right?
First thing, I just want to respond to it by saying two things. The cancer is caused due to the interaction between the genetic factors and the environmental factors. You see, the smoke, the cancer is caused by tobacco or the smoking. Okay, there is some side that has been implicated, the use of tobacco, but there are some instances where there is no association of tobacco, but there is some cancers. There are some people there are some groups of people, there are some public who are genetically determined to some form of cancer which are incidentally related to those tobacco-related sites. Okay, esophagus, number one, esophagus is a tobacco-related cancer. But in our place, in Assam in particular, many ladies, I just want to tell you that Kamrup urban district, there is a cancer registry in Guwahati. In India, the incidence of esophageal cancer in female is highest in India. Okay, but if we see in general way, it is the smoking habit, smoking prevalence is not very common in the ladies of our, our place. There are some other factors. One is tobacco. Tobacco quid that is contained in the mouth for a longer period of time. Bad oral hygiene. Then one important thing is human papillomaviral infection. How it comes, we do not know, but we have seen that over and above. And one major factor is alcohol. So, tobacco, alcohol, bad hygiene, HPV, these are some of the factors that has been seen with the observation for a long period of time. So, it may not be tobacco, but you see that we cannot allow tobacco to use. But if we stop tobacco, in and around the ambience will be clear from the tobacco smoke, and all the people will be safe from tobacco. At least there will be reduction of by 20 to 30% incidence of cancer.
Okay, Dr. Bhuya, would you like to add to it? And please, we want to know more about various cancers, as he said in the beginning of the show. Can you just give a light on it?
No, as Dr. Sharma has already said as an answer to her question, basically every individual has genes, and there are some genes which are called cancer genes. We scientifically call oncogenes. These are there. They are dormant. They are lying there, they are sitting there. There are some environmental factors, the factors in the environment, like tobacco, like pollution, vehicular pollution. These are equal things. Even sunlight sometimes stimulate these genes to become active. And when this gene becomes active by these environmental factors, we call that gene has become mutated.
Okay.
This is what is scientifically taught. And this, when it happens, then a cell becomes malignant or cancerous. And one cell, as I said, when it becomes cancerous, after that it grows exponentially and suddenly forms a
And it can cause any type of cancer, or there is a specific cancer it usually causes?
Tobacco-related cancers are little identified, as we have said, but cancer as a whole usually happens like this. And in many cases, we don't know what is the actual environmental factors which has caused this cancer.
Okay, can
as
we
in
have...
her case, patient not
Dr.
smoking.
Bhuya, yeah, continue. You want to say something?
Person who has never smoked, but also has got cancer. So there is some other environmental factors other than tobacco which has done this.
One important aspect is this Westerner lifestyle. Western lifestyle that has been predominant nowadays in not only speak of any city in the Guwahati, is a very much fast food, highly pressurized, highly hot food available so fast. So this is called fast food. These are likely to liberate lots of hydrocarbons out of the food itself. So it is very
many factors are there, and I think we need more of the time. So before our time elapses, let me include another question from our audience. Yes, I think I can see you. Yeah.
Hello, sir. My name is Vigyan Gogoi. Actually, sir, related to this tobacco related question, sir, I would like to ask you, what are the symptoms of this cancer? Symptoms of the cancer?
Yeah.
Tobacco related cancer.
Yeah, tobacco related.
Actually, it will depend on where the cancer has started. If it is in the lip here, it will start as a small ulceration or a small swelling, which you can see on the mirror. This could be there. If it is in the throat, you will feel any soreness in the throat, something sticking, something like a fishbone sensation. This could be first symptom. If it is in the food pipe, which we call esophagus, you will feel that when you swallow food, it gets stuck. It does not pass. So depending on the site where the cancer has grown or started growing, your symptom may vary.
Usually symptoms are there, or it actually comes out very late.
And the symptoms are there, but the symptoms, they starts very slowly, gradually.
And usually we neglect these symptoms.
At the very beginning, you feel that it's nothing.
Nothing. It's just a part of life.
Till it becomes big, or it really gives you a very big problem.
Okay. Doctor, you have said lips, there is some, some thing comes
tube.
up, swelling or something. So I just want to know from Dr. Sharma, do we find any kind of bodily deformation if you have a cancer?
One very good example
Especially
is,
not cancer, I'm saying, if you smoke
yes.
for a longer time.
Yes.
Can you see some stains on your fingers, on your lips?
So that is very obvious, but one thing, prolonged smoking, it may not cause cancer, okay? It may cause lots of obstructive lung-way diseases. He may have some bronchial asthma. He has some obstructive lung-way disease. Okay. So he starts taking a different posture altogether for quite a bit of time. So his shoulders should be, shrugging. Then he always bow down as if he is trying to get more oxygen from the air. So his posture will be quite different from otherwise a non-smoker.
Okay, because he smoking, long time smoking has put pressure on his heart. So
heart and lung both.
Heart and lung both. That's very good. Doctor, we all actually discussed that. Even the audience raised the question why it is more prevalent among the younger generation. Earlier, historically speaking, the lung cancer was not common until World War I. Yeah. But now the public perception is that tobacco use means you will get lung cancer, and it is etymologically also very it's common. So what do you feel? Why this tobacco use is very prevalent in the Gen Y?
Actually, as you see that the young age, adolescent age of the people, boys or girls, this is a time when the children pick up new things, and they are attracted to things which are attractive to them, which catches them. They go and make an experiment with this. Now, today, a group of boys, if he sees Rajnikant playing a cigarette in the film and putting it like this,
we were discussing before the show,
they will also try. 2 or 3 of them will try, and then one of them will do it, and the others will follow. And gradually they fall into this habit of taking the cigarette.
Very rightly said, Doctor. Unfortunately, our media is not playing. Media means especially films are not playing the responsible role. As you said, Rajnikant, if he flips his cigarette stylishly in every movie he does, definitely the younger generation will follow him. Even Shah Rukh Khan does not follow the motto no smoking. And we have Ajay Devgan. Recently, we have Ajay Devgan and Arshad Varsi who were caught by police for smoking in public, especially in the vicinity of a school. And also we had yesteryear glamour girl Tanuja was clicked smoking. So what do you feel, Dr. Sharma? Are our public personalities playing the role responsibly, or they are sending wrong messages through these incidents? What do you feel about it?
Indirectly they are encouraging, basically. They are basically encouraging. They should have taken the role of, a tobacco cessation. They should have started tobacco cessation clinic, but they have started advertising tobacco product.
Directly or indirectly.
So government alone cannot do it, because we have to be motivated. Our public leaders should be motivated not to lead the people in the wrong way.
Government is doing a lot. Government
is
doing a lot
by and government will always do gradually, step by step. But I feel that measures should be more stringent. Measures should be more stringent.
Right. So, Doctor, again, I would like to know, do you feel banning smoking? Okay, I want both of your comments because you are esteemed doctors. Okay, so what your opinion as a doctor? Do you feel that banning smoking altogether at public places would be effective? Because in many countries it has been banned.
I feel it's going to be very effective. But at the same time, I like to add, it's not only smoking. Banning use of tobacco. When we say smoking, you are leaving out the non-smoking, smokeless tobacco. So banning tobacco altogether. In one meeting, where there were influential political people with us, we had really told like this: if you can stop tobacco entering from Sri Rampur gate, how our small children will get tobacco here? Then our esteemed politicians he has told, we can do that. You doctors cannot do that. We politicians can do that, but we have to go stepwise.
We have to go stepwise, and media people have to play their role responsibly. Even the advertisers have to play their role responsibly, because they actually target the impressionable minds who actually come into the what you call glamour of advertising. So what you feel, Doctor? I will want to take the message from you for our viewers,
So,
and especially for them who want to quit smoking.
Actually, one important thing that we might have missed, that cigarette is not the common, it's not very common. It's a BD only in Indian subcontinent, and particularly nowadays it is exporting to the United States also. It is believed that BD is cheaper, so it is less harmful than cigarette, but it is equally harmful. So banning tobacco in all forms. Two things: there should be stringent measures from the legislators, and the people should be motivated. And I hope this show is going to have a good effect on the public also. And
we hope so.
I hope so.
We hope
and,
so.
But the people have to be motivated, and because we're trying to educate them, and so this is the message.
Okay,
can I add a little bit?
Sure,
Yeah.
very briefly, doctor.
Anybody who is smoking tobacco or cigarette should not feel that he is taking a filtered cigarette, so he is not going to have the bad
Nowadays,
things. He is filtering the bad
artificial
things.
smoking
No,
has come, yeah.
the filter which is given in the cigarette does not filter anything. It only filters the particles. But the
Okay.
gases, as I say, nitrates, all go inside. It's
Very
a
well said,
pseudo
yeah.
feeling of safety, so it's not there.
It's a pseudo feeling of safety, so be aware of that. And we really hope our viewers have enjoyed this discussion, not only liked, but have learned something and will take the advice of our eminent doctors. And people, it's a cliche, but it's worth following. Prevention is the best medicine. Don't you think, doctors?
Yes.
Prevention is the best medicine. And we want to say, people, that stay healthy, be happy, and always remember that kick out this habit of smoking. Otherwise, smoking will kick out the life out of you. Thank you very much for watching our show, and thank you, doctors, for coming
Thank
out
you.
here. Thank you, audience, and we do hope you will definitely watch the next episode of Health Ins on PPC Northeast Doordarshan. Thank you.